Hello, good morning, good afternoon, good evening, wherever you are watching me from. This is J Diva Official on Facebook, YouTube, and Instagram. So today I'm going to be talking about Angular Cheilitis. Angular Cheilitis and drooling or hypersalivation. Angular cheilitis is when you have the saw in your lip. There are some people that have this two-edged saw that is crack, both up, both down. That is what they call angular cheilitis. Then drooling or hypersalivation is people that they have excess saliva in their mouth. Excess saliva, that is those people that you will see that when they are talking, the edge of their lip like this will be foaming, thick foam, and it's not normal. It's a sickness, it's infection, and the infection is called sinus infection. Sinus mouth infection. They have other names for it, but I just want to call this simple one. Angular cheilitis is infection, and it can transfer when the person is using cup with another person. Then drooling too or hypersalivation is infection. It can transfer when you use a cup with somebody or you kiss the person. This week, during this week, I went for a seminar, and one of the guy that was taking us the seminar, that is why I'm making this video. There are some things that what you don't know, and people say what you don't know pass you. This guy entered the hall, he was just smelling fine, dressed smart, cute. Then when it was time for lecture, as he was talking, oh my God, I feel pity for him, because his own was much. The lip was just foaming, and foaming and very thick, because that saliva that used to hang on this edge of the lip is not the normal saliva from the mouth. That is why it's infection. The lip was just foaming, and he was using his hand to clean the lip like this. Imagine a young man talking in public, everywhere was just foaming, dancing. He will use his hand, sometimes he will just use, sometimes he will lick the mouth like this. Oh my God, I feel bad for him. And you know what? These things, God gave us natural things for the treatment of all these things. Angular cheilitis is when you have sore in your mouth. It's the same treatment. In my place, this angular cheilitis, we call it a beke. In my place, if you have a name in your language, we know everybody have a name for all this sickness in our languages. Please, you can put the name in the comment section. It's just one treatment, simple something that you can use, and which is bitter leaf chewing stick. This is bitter leaf. This is bitter leaf. I will put it in the comment section. This is bitter leaf. And you know what people nowadays are having that problem, or it's because paste have come. Toothpaste, we have them different type of toothpaste. We have the toothbrush, different type of toothbrush. But do you know that those things are chemical? And do you know that you might be reacting to a particular toothpaste and you will not know? So to overcome angular cheilitis or drooping, angular cheilitis is when you have the crack in your lip. Then drooping or hypersalivation is when you have that excess spit. This excess spit is different from when a woman is pregnant too. It's not when a woman is pregnant. When a woman is pregnant and the child is forming in the womb, there's that tendency of nausea. It's different. I'm talking about ladies, men. They are not pregnant, but when they are talking, their mouth will be foaming. Excess saliva will be coming out, foaming at the edge of the mouth like this. Even you, when you look at it, it will be so irritating. And some of them said they don't carry like Anki or anything. They would be talking and be like this guy that I was talking about. He faced people that he was lecturing And this thing was coming, and he was using his right hand, using his left hand, and at the same time he was operating the projector. Oh, I felt bad for him. And he's somebody that I was close to. If not, I would have told him. I was not too close. And that is why I'm making this video. It's a simple thing that we use to treat it. This is bitter leaf chewing stick. Because of modernization, too much of paste now, people don't even use chewing stick again. Chewing sticks have so many benefits. Because when you are chewing stick, you are reinforcing your teeth to your gums. You are clipping them more to your gums. But this particular bitter, and you know this chewing stick that our people used to take in these days, they are medicinal trees from the forest. Medicinal trees. That is why you see people in those days, their teeth are very strong. So what do you do if you are treating Angular Cheilitis or drooling, that is excess saliva from the mouth, is this bitter leaf chewing stick. You put it in your mouth and chew it. Don't peel it, please. Don't peel it. Chew it as a chewing stick. You can use it to clean your teeth. Brush everywhere. If you chew at this side, transfer it to this side. And as you are chewing it, swallow the water. Swallow that bitter water. Don't peel the back from it though. Chew it with the back, because that is the wonder for that mouth infection. That is the wonder. You cannot have a saliva in your mouth like this. Maybe you want to talk to a girl. A young man want to go and talk to a girl after dressing, speaking all the grammar, then they will not be seeing foam. The simple remedy, chewing stick. Chew it, swallow the water, use it to be cleaning your mouth, at the same time you are reinforcing your teeth to your gums. People these days don't chew chewing stick, they are medicinal. After chewing the chewing stick, you can use any paste that you are using at home. You can use it to clean your mouth, brush your mouth. Then you see this one after brushing. Maybe you want to go out. This is cloves. I'll put it in the picture. This is cloves. You can put 2 cloves in your mouth. You chew them. You chew the cloves. And when you are chewing the cloves, after grinding the cloves in your mouth, make sure you use your tongue to clean your lip like this with the cloves. Use your tongue after chewing the cloves. Don't swallow it yet. Use your tongue to clean your lips up and down. If it is the cracked lip, it will heal. Then if it is that drooling, that is hypersalivation, it will stop. Then when you want to go out, when you finish with the cloves, swallow it. Don't use water to rest your mouth. Leave the cloves like that in your mouth. Then you get this black seed oil. This is a healing balm. I've been talking about this black seed oil. You get this black seed oil. Use it to do your lip gloss. Use it to oil your lips to avoid that cracking and avoid that excess saliva coming to your mouth. And you know what? Well, one of the things that normally causes it is when you lack vitamin B2. If you are a man that you are suffering from that thing, or a woman, and your wife is still breastfeeding, like you as a breastfeeding mother, you know you are experiencing it, you can just squeeze your breast in a tablespoon and drink it morning and evening. It contains vitamin B2. It contains a lot of vitamin B2. As a man, don't put mouth in your wife's breast if you know you are suffering from that thing, so that your child will not go and suck and still carry the infection. Newborns, they carry infection. That is why you see some family, you see the father having it, mother having it because they are kissing, then children too will have it because they are using the same cup. Please avoid those things. God has given us everything. Cloves, chewing stick, bitter leaf chewing stick. Use bitter leaf. Bitter leaf chewing stick, when you cook with bitter leaf, it's bitter but it won't do anything, because as you swallow that thing, it's healing you from inside. And it's because you have your face is not firm. There's a loose in your joy bone. There's a loose up there. That is why the excess saliva is coming. So as you are showing this thing, you are reinforcing your gum, working on your joy. All the bones, you are making them firm. People these days don't chew stick. As you see me here, village woman, when I be, from time to time I cut bitter leaf and chew. It's very, very medicinal. So please keep doing this. There are some things we avoid when we really do the normal thing. And you know what? You can go and see your doctor. There is a swab they used to do, like your dentist, your dietitian. Go and see your doctor. Go to the hospital. Go to general hospital. They have specialists for everything in our body. They will do a swab test and they will tell you the degree of the infection. So please take care of yourself. Take care of your mouth. Take care of yourself. Health is wealth. See you on my next video. Love you all. Bye.